Okay, so the second topic that we're going to cover in section 3 is work. We touched earlier on choices and demands, and as I said, some people see work as a choice, some people see it as a demand, and we know there is a link between persistent pain and people struggling to actually do their jobs. Before we look at how to remain in work or get back into work, we're going to look at some positives and negatives to do with work. The first thing we're going to look at are the positives. Number one thing people tell us all the time, the reason why they go to work is for income and money, and to an extent that's very, very important, but it's not always the most important thing about work. Some people tell us that the reason why they enjoy going to work is because of their colleagues, that they build up a relationship with those, or the clients that they work with, depending on what type of job that they're doing. Lots of people enjoy the responsibilities that they're given at work, and as they go through their work lives, the training that's invested in them so that they can develop new skills. That can then lead to promotion and a career, and of course they can pass those skills on to other people as well. We know that a routine is really important, so knowing what you're doing and when you're doing it, which can give us a sense of purpose. In lots of jobs there is a social side to work as well, so going out on works do's, or if it's somebody's birthday, having a nice lunch. It's not just the physical things that improve when we're going to work. There's the mental health side of it. When we get stimulated, when we're challenged at work, that can really help us to keep going. And also then at the end of the day, whatever job you've done, looking back and saying, I did this really well to the best of my abilities, gives us a real sense of achievement. Now we know that not every workplace is fantastic, and there are some negatives of work as well. One of the top ones that people tell us about is stress. We can put ourselves under pressure, or our colleagues might do, to try and get work done under strained resources. It could increase people's pain. So if you're already in pain and you're asked to be doing certain activities, that might increase it. Nobody likes being told what to do, but we know in some jobs that is the case. Sometimes it's a lack of understanding of our colleagues. They don't see our pain, and therefore they don't understand how difficult it might be for us to do certain roles. And sometimes you don't feel valued at work. Not always do people say well done or thank you, and sometimes that can leave us being frustrated. They've done lots of research into work, and we know that people who can work throughout their careers have better both physical and mental health, as well as the money side, which I touched on earlier. One of the most important things is being able to make decisions at work, and those people who are able to be autonomous and decide how they go about their jobs find that they get a much better sense of job satisfaction. But as I touched on earlier, pain can often stop us from being able to do our work in our normal way. And often if we wake up in pain and we've got a job, we've got to make a decision as to what we do. Do we go in that day or don't we go in? Now, all the evidence suggests that if we can remain in work, it is better for us. It might mean, if you're feeling more pain on any given day, that you need to speak to your line manager or your colleagues, because there might be some duties that need to be modified, at least to get you over this flare-up in pain that you're feeling, or it might be longer term, we need to do a risk assessment to make sure that you can carry on doing your job. If you're unable to go into work, for the first few days you can self-certificate, you don't need to go and see your doctor. But after a week, people traditionally, if they felt they weren't able to get back into work within that time frame, go and see their doctor for what would have been a sick note in the past. Nowadays, the doctors can hand out fit notes, which tells your employer what parts of your job you can still do and other bits that you might find a struggle at present because of your symptoms. If you have had some time off work and you're needing to get back into work, sometimes going back in full time to do your normal duties that you did previously might be very difficult. So it might be worth planning what we call a phased return. So this might be going back on reduced hours at first and then gradually increasing your workload slowly over time. Now normally if that's the case, certain people might want to get involved in this process. Occupational health, human resources, your line manager, you might even have a representative, for instance, from a union who's at that meeting, just so that you can all plan how you can get back into your role. Now, sometimes with the best will in the world, people struggle to actually get back to their normal job, and therefore, depending on the organisation that you work for, they might think about redeploying you into a different role. If you've tried this and you're still struggling, you might be looking at doing the same role that you would have done normally, but maybe for another employer. Because it might be that if you're struggling to work, for instance, as a nurse on a ward in a hospital, you could work in a GP practice. So you're still doing your normal role, but you're doing it somewhere else. The last option, if somebody's tried all this and you've not been able to maintain your role that you did previously, is to look for retraining in maybe a different role. And there's places like the Job Centre Plus that you can contact who have disability employment advisors who can help with that process.